Laura Keogh-Smith, a Labour MP, has poignantly highlighted the stark inequalities within England's perinatal mental health care system, describing it as a postcode lottery where disadvantaged women are disproportionately likely to be denied crucial support. Her impassioned plea follows the devastating suicide of a close friend just 10 weeks after childbirth, despite the friend's repeated attempts to access mental health services for her escalating anxiety. This tragic event has galvanized Keogh-Smith to advocate for significant improvements in perinatal mental health care, bringing the issue to the forefront of parliamentary debate on Wednesday. Keogh-Smith's powerful testimony underscores the urgent need for systemic reform. Her call to action focuses on 4 key areas, demanding concrete steps from the government to address the crisis. Firstly, she advocates for the explicit protection of specialist maternal mental health care within the NHS's 5-year mental health plan, ensuring that women experiencing severe mental illness postpartum receive the intensive support they desperately need. This is not simply a matter of funding, but a matter of recognizing the unique vulnerability of new mothers and prioritizing their care. The current system, she argues, often fails to adequately address the specific needs of this population, leaving many women struggling in silence and without access to appropriate interventions. Secondly, Keogh-Smith emphasizes the critical need for better integration of mental health services into all routine aspects of antenatal and postnatal care. This means embedding mental health checks as a standard practice throughout pregnancy and the postpartum period, ensuring that early signs of distress are identified and addressed proactively. Currently, mental health often takes a backseat to physical health concerns, leading to delayed diagnosis and treatment, exacerbating the severity of mental health challenges. A seamless integration of mental and physical health assessments would allow for early identification of risk factors and timely interventions, potentially preventing tragic outcomes. This integration requires a paradigm shift, moving away from a reactive approach to a preventative one. Instead of waiting for women to reach a crisis point before offering support, proactive screening and readily available resources would empower women to seek help early and avoid escalation. This requires not only increased funding, but also robust training for healthcare professionals, equipping them with the knowledge and skills to identify and manage perinatal mental health issues effectively. Thirdly, Keogh-Smith's proposal highlights the necessity of challenging the pervasive societal misconception that mental health support is a luxury rather than an essential component of maternity care. This stigma prevents women from seeking help, fearing judgment, or feeling like their concerns are trivialized. A concerted public awareness campaign, alongside widespread education for healthcare professionals, is crucial to destigmatize mental health and encourage help-seeking behavior. This campaign should emphasize that mental health problems are treatable and that seeking professional assistance is a sign of strength, not weakness. The narrative needs to change from viewing mental health issues as an embarrassing burden to recognizing them as a common and treatable condition requiring compassionate support. The fourth and equally important aspect of Keogh-Smith's proposal emphasizes the critical need for equitable access to mental health services across all socioeconomic groups. Disparities in access are deeply entrenched, with women from disadvantaged backgrounds facing significant barriers to receiving. This inequity is unacceptable and demands immediate attention. The proposal calls for strategies to address these barriers, which may include providing culturally sensitive services, improving accessibility for women in remote areas, and addressing financial constraints that hinder access to care. This requires a multifaceted approach that tackles the social determinants of health and ensures equitable distribution of resources. The Alliance for Maternal Mental Health, which is supporting Keogh-Smith's initiative, echoes her concerns. Karen Middleton, the campaign head, strongly advocates for a paradigm shift in the way society views maternal mental health. Middleton rightly points out that maternal mental health problems are treatable conditions, and the right support can be transformative, even life-saving. This underlines the urgency and critical importance of the proposed changes, emphasizing that the investment in perinatal mental health services is not just a cost, but a vital investment in the well-being of mothers and families. Failure to address these issues has devastating human consequences, leading to suffering, family breakdown, and, tragically, as in Keik Smith's friend's case, death. The tragic loss of Keik Smith's friend underscores the devastating consequences of inadequate perinatal mental health care. It is a stark reminder of the human cost of neglecting this critical area of public health. Her advocacy serves as a powerful call to action, urging the government to prioritize the mental health needs of new mothers and implement systemic changes to ensure that no woman has to suffer in silence or face insurmountable barriers to accessing vital support. The reforms proposed are not just about improving healthcare, they are about saving lives and ensuring that every mother receives the care and support she deserves, regardless of her background or postcode. The silence surrounding perinatal mental health must end, and the systemic inequalities must be addressed swiftly and decisively. The time for action is now. If you are struggling with your mental health, please reach out for help. You are not alone. Contact information for various crisis support services is listed below.